I'm going to talk real quick about bipolar. This is something that a lot of people struggle with. This disease can be debilitating. It complicates all aspects of one's life. Left untreated, it will hinder relationships, affect employment. It'll interfere with nearly all social interactions. I mean, very often it's accompanied by depression, anxiety, and extreme mania, all of which can completely consume everyday living with the person affected. Bipolar not only hurts the people around the affected individual, but ultimately, left unaddressed, could lead to violent outbursts of anger, followed by extreme depression and guilt, often leaving the individual confused about why things even happen the way they do. This is not a condition that one chooses. There could be many different factors that contribute to the evolution of bipolar. So how does bipolar develop? Some experts lean towards genetics, some more towards environmental exposures, life, just situations, traumatic situations that occur throughout one's life could lead to this. And in some cases, prolonged drug abuse may be the culprit. There's really no way of knowing. What we do know is this diagnosis has become much more prevalent throughout the decades. Whether or not this is due to increased awareness and recognition of the disease and its prevalence, or maybe if the commonality of bipolar is increasing, what is causing this? I mean, although this disease can vary in severity, any level can interrupt a peaceful existence. There are many opinions and theories of the treatment of bipolar: medications, nutrition, fitness, and many other therapies, from electroshock to hypnosis. Although there is no set-in-stone fix for bipolar, any combination of the aforementioned treatments could work well for one individual and be virtually ineffective for another. Unfortunately, leaving the majority of its sufferers out in the cold, so to speak. With many conventional doctors and the majority of treatments ineffective, confidence in the so-called system is diminished. And many suffering from this disorder become content with the disabling complication and living a very minuscule existence, often leaving them alone and isolated for the duration of their lives. Left untreated, this is a very serious issue. Understanding how it's evolved and why it's becoming more prevalent these days is the big question. Some research is leading to sodium levels, heavy metals. There's many different things that could contribute to it. I guess my point is, this is something that needs to be addressed, should not be ignored. And if you're struggling with bipolar, get some help. I believe nutrition and fitness can be the number one contributors to living with this disabling problem. It can really help a person feel much better. Fitness and nutrition.